How does our next witness wish to be known?
His name is Mark.
Mark. Mark, please.
Please state your full name.
Mark Anthony Stewart.
Take the book in your raised hand and repeat after me. I swear by Almighty God
I swear by Almighty God
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Mark, you have mild von Willebrand's disease, as did your late brother and late father.
That's right, yeah.
Your late brother died of hepatitis C following infection from factor VIII, and his widow will be giving evidence later today, but you've asked for a photograph of him just to be put up at this stage. It's number 39. And before I ask you about your own treatment and infection, I want to briefly touch upon your father, and we also have a photograph of him at 038. And he was Angus Senior.
Yep.
Your dad was diagnosed with von Willebrand's after you and your late brother were diagnosed.
Yep.
And it hadn't affected him as a child and young person, though later on he needed some prophylaxis to control nosebleeds.
That's right, yep.
We'll come to when he was infected a little later, but in terms of being told about having hepatitis C,
Yep.
your understanding is that your dad was never told he had
Never told.
hepatitis C. You've looked through your dad's records, and for various reasons we won't put them up on the screen, but there's a letter in 1990 telling your father that he has hepatitis C,
Yep.
but there's no address on it.
That's right.
And your understanding is that your father never received it.
That's right.
And then if we have document 1000-030, please, Paul. This is a letter from your father's records, but exhibited to your own statement. And we can see at the bottom of the second page, sorry, you were just there a moment ago, Paul. There it is. Within the letter to his GP, it says he has chronic hepatitis. We know that he had non-A, non-B hepatitis in March 1980 when he had his first exposure to factor VIII, which at that time was unheated. This is very well documented, and we know now that he's anti-HCV positive. His AST is consistently abnormal. We're now in the process of treating some of our patients who have chronic non-A, non-B hepatitis with interferon. I mentioned this study to him, but he said we can leave him out. However, I feel I have explained to him about non-A, non-B hepatitis and the possibilities of that kind of treatment in the future. It's a letter from Dr. Lee to your dad's GP in 91.
Yeah.
What's your view of that part of the letter?
He didn't say that. He wouldn't say that. If you're just being told you've got hepatitis C, but we've got a treatment, you're not going to say, oh, you can leave me out. He wouldn't have said that. You know what I mean? And that's the other letter, what I said ain't addressed to him. At the top of it, it says, and that was in, I think, July 1990, it says on it, review on the 8th of March. So that letter weren't sent. This was the first he's saying he's been told, which he wasn't, and he wouldn't have said no to treatment.
You and your mother, your understanding is that your dad was never told that he had hepatitis C.
Yep.
And then sadly in July 2002, your dad was told he had an enlarged liver and hepatocellular carcinoma.
Yep.
And he died in September 2002.
Yep.
Mark, when you were a child, how often did you require treatment?
Once a month, something like that. Not even that. Once every couple of months. I'd have little spells, you know, and then it dry up for 6 months and have a couple more bleeds. Just little nosebleeds, that's all they were.
It was really just the nosebleeds that was a problem for you.
Yeah.
When you were in hospital in November 2006, you had a look through your medical records
Yep.
and found some old blood test results.
Yep.
At that point in time, in 2006, had you been told anything about hepatitis C?
Nothing.
Could we have document 1002, please? This was one of the documents you found when you looked through your medical records. It's a blood result from the 2nd of June 1992, and we can see towards the bottom hepatitis C antibodies by EIA positive, hepatitis C antibodies by REBA indeterminate result. And then if we have 003, please. Another result from the 25th of November 1994. Again, at the bottom there is a positive result by EIA and a reactive result by REBA. And if we just pause and note your hospital number at the top of that page, 217031, and if we then go to 005, please, Paul, we have a further blood test result from November 2002 that says HCV RNA not detected. But then on closer inspection, you notice that the hospital number on that test result is different.
That's right, yep.
When you saw those results in your medical records, what went through your mind?
The saying wasn't right. You know what I mean? Because I know my dad died of liver cancer, and on his death certificate it says hepatitis C. But that's it. We weren't told the connection with hepatitis C that caused liver cancer or anything. Because at the time of my dad's death sort of thing, it was his lifestyle. That's the way the doctor said it sort of thing to me mum. And we just assumed it was, one of them things haemophilia's got. But there was never any discussion, anything.
You've said in your statement that when you saw the results, you were very worried and very confused about what was going on.
Yeah.
You spoke to the doctors, and they retested you.
Yep.
And in January 2007, those tests came back positive.
Yep.
And if we can have document 007, please, Paul. The tests came back in January 2007, and we have this letter from the 14th of February 2007. And it records this. This patient was found to be hepatitis C, HCV, IgG antibody positive in November 2002. However, HCV RNA was not detected in serum tested around the same time. We didn't receive any follow-up sample until recently. They'd then done a retrospective analysis of the 1999 and 2000 samples, and they were positive. And in the next paragraph, the letter says, the initial RNA test in 2002 was performed by an earlier version of the PCR assay, which possibly gave a false negative result. However, at this stage, we cannot exclude any labelling or sampling errors. I'm extremely sorry for this mistake. If a patient is found to be HCV antibody positive and RNA negative, as was seen in this case in 2002, please send a follow-up blood sample to confirm these results. It's recommended that patients with these discordant results should be tested yearly for HCV RNA to monitor any change. you're concerned about why samples weren't checked earlier and why you weren't automatically recalled for further testing.
Yep.
Because of that discovery that you had hepatitis C, you then wanted to know when you'd been infected, and that's what we're going to look at now.
Yep.
You worked your way back through your records.
I did, yes.
Throughout your childhood, you were treated with cryoprecipitate,
Yeah.
except for one occasion.
One occasion.
Throughout that time of receiving cryoprecipitate, what was your understanding of how successful it was?
Very successful. That's
Did you have any problems with receiving cryoprecipitate?
no.
Can we have document 1000-012? This is a document from the minutes of the UK Haemophilia Centre directors on the 30th of September 1980. And if we go on to internal page 9 of the document, we see a heading of hepatitis. And it says this: Dr. Krask presented a short written report outlining the findings of the Working Party during the last year and described future plans of work to be undertaken by the Working Party. Various projects were progressing in Oxford, London and Sheffield. Liver biopsy studies were being undertaken at the Royal Free Hospital and at Sheffield. The preliminary results will be presented that afternoon. And at the bottom of the page, the Working Party planned to continue with the national surveillance for hepatitis C, and symptomless causes of hepatitis were being studied in detail at the Royal Free and at Oxford. Large pooled concentrates appeared to give a higher risk of hepatitis than small pooled concentrates, and Dr. Krask felt that that increased use of small pooled concentrates would help to reduce the incidence of hepatitis in the haemophiliac population. First-time exposure to large pooled factor VIII concentrate resulted in many cases of hepatitis, especially in von Willebrand's disease patients. Professor Bloom wondered whether cryoprecipitate would be a better product to use for mild haemophiliacs and von Willebrand's disease, but pointed out there was a problem over the amount of factor VIII in these materials. Dr. Krask agreed, and he said that the NHS product was certainly better than the commercial products because of the screening of the blood donors and the regular donor panels which were used in the UK. You've highlighted that because of the date, the 30th of September 1980. And at that point in September 1980, you'd only been given cryoprecipitate.
Yep.
Could we have 1000-008, please? This is a note from your medical records dated the 12th of May 1981. And your consultant is noted as Dr. Kernoff. And it says that you have epistases and that you are to commence concentrate on the left-hand side of the screen. And then if we go to 019, please, 1000-019. We have another entry relating to the same date, the 12th of May 1981, which indicates in the middle of the page, spontaneous epistasis, cold in the head, unresponsive to 1020 units of concentrate, slow response to cryoprecipitate, and that you were for admission. And at the bottom of the page, we can see that a further note later on in May is made by Dr. Tuddenham, which we'll come back to later. And then if we can have 010, please. We have a note again in the middle of the page, the 12th of May, which shows that you were given treatment with BPL 510, and the next note, further treatment as above. And at the very bottom of the page, on the following day, it notes LFTs weekly for 6 weeks. So that was the only time you were given factor 8. And on that occasion, were you or your parents warned of any risks involved in you having it?
No.
And were you or your parents told that your liver function would be tested afterwards?
No.
You have some very specific concerns about why and when you were given that factor 8. What can you tell us about that?
I'm sorry, so I've lost the.
Don't worry,
Me wrote then.
don't worry. You are particularly concerned that you were given factor 8 on that occasion, on that date,
Yeah.
in light of the Haemophilia Centre minutes.
Yeah.
Can you tell us what those concerns are?
That I should be having cryoprecipitate. That concentrate, carried the risk of hepatitis C. They knew that. And they still give it to me.
Because you had mild von Willebrand's,
Von Willebrand's.
and until then you'd had cryo.
Cryo. I used to go to the hospital for cryo. I wasn't on home treatment. I was just a mild. Von Willebrand's, mild. Never had concentrate.
You're also concerned that you've been used for the purposes of research.
Yep.
And we're going to go through some of the detail of that.
Okay.
Could we have document 100014, please, Paul, 14. Now, in the top right corner, it says first exposure date of the 5th of December 1981. Well, we know that isn't right, and it should be May 1981. But what we can see
I think the dates are the same. Instead of being 1205, it's 0512.
Thank you, sir.
Position.
Absolutely. And if we look down on the right-hand side, there's a table which indicates serum date. And if we look at the 14th of August 1981, your AST was tested at 154. And if you therefore look at the number of days between the 12th of May through to the 14th of August, it's an incubation period of 94 days.
It is, yes.
If we could have 013, please. It's a letter to your GP which discusses the elevation of the AST, and it, in the last paragraph, refers to your AST being elevated in August 1982, 6 weeks after receiving intermediate factor 8. Again, you think that's a typographical error, and it should obviously be August 1981.
I only had it once, yeah.
Now, the reason I've taken you through those points is because you've had concerns about the treatment in 1981, and you located some academic research papers written by Professor Kernoff, Dr. Thomas and Professor Lee.
Yep.
Could we have document 100024, please? We're just going to go through the paper before we get to a particular table. The study is called a study of the high risk of non-A, non-B hepatitis after a first exposure to volunteer or commercial clotting factor concentrates, effects of prophylactic immune serum globulin. And in the summary, it says after a first exposure to factor 8 concentrates, 9 out of 9 British patients treated with USA-derived commercial products and 10 out of 12 treated with British volunteer NHS products developed acute non-A, non-B, NA-NB hepatitis. If we turn the page under patients and methods, that's right. It describes how the study was set up. During the 5-year period, April 1978 to March 1983, 58 patients with congenital deficiencies of coagulation factors 8 or 9, received 60 first exposures to factor 8 concentrate, factor 9 concentrate, or cryoprecipitate at the Royal Free Hospital Haemophilia Centre. Events following 31 of these first exposures, which included 5 episodes in which ISG was used in addition to concentrates, were prospectively studied by serial clinical assessment and blood sampling before and after exposure. Only a minority of the patients were virgin, although most needed infrequent treatment. A majority had received blood, plasma or cryoprecipitate therapy before their first exposure infusions. If we carry on down that page, blood samples were taken and patients clinically assessed immediately before their first exposure infusions at 1 to 2 weekly intervals for the next 3 months, and at 1 to 2 monthly intervals for a further 6 months. Biochemical liver function tests were carried out on all blood samples and were normal in all patients before first exposure infusions. Sera were stored, frozen, and selected samples from all patients retrospectively analysed for serological evidence of acute or previous viral infection. And it's noted in the next paragraph that the occurrence of acute post-infusion hepatitis was the primary endpoint of the study. We then carry on through the paper to Table 1, which gives the results of the study. And it's your firm belief that you're patient number 11 on that table.
I am, yes.
If we look at patient 11, we can see that the age then was 13, but you think that's out because of that typographical error between August 82 and 81.
Yeah, the letter sent to the doctor, yeah.
But you identify as that patient because the incubation period is the same.
Yep.
And because you were symptomless, the
Yeah.
0 in the final column.
Yeah.
So there are a few details that don't match. The AST and the dosage is a bit unclear, but otherwise you identify as patient 11.
Yeah. I had 2 doses and cryoprecipitate up until that date, yeah.
You also believe that your brother was patient 19
For sure, yeah.
and your father was patient 18.
Definitely, yeah.
If we can just look a little bit in more detail about your father, if we look across line 18, we can see that patient 18 was aged 42, having been given NHS factor 8, and at the end of the line, an incubation period of 48 days, resulting in symptomatic jaundice.
Yeah.
So if we can then have document 1000-027, this is a document called Form C2, a hepatitis survey form. And if we look at the table, we can see in the middle there is Elstree factor 8 concentrate with a date. And at the very bottom in handwriting, non-A, non-B hepatitis attributed to batch number HL2644. And we can see there that your father was given his first batch of concentrate on the 11th of January 1980. If we go to 1000-026, in the middle of the page, we see a note, just above that, Paul. Estimated approximate date of onset of hepatitis, 17th of March 1980. That would give an incubation period of 66 days. But in your dad's records, there's a document that shows that there was a marked rise in his AST on the 28th of February 1980, which would give the 48-day incubation period.
Yep.
And that's why you say you think your dad was that patient.
Yep.
it's your understanding, therefore, that your dad was infected by the first batch of factor VIII that he'd received
Yep.
by NHS concentrate.
Yep.
As far as you and your mum are aware, did your father ever consent to being part of a research study?
No.
And did you ever consent to participate in the study, or your parents consent on your behalf? You have further concerns that you were used for research without your knowledge in 1998 as well.
Yep.
Can we have document 1000-15, please? This records you being seen by a registrar while you were visiting your father. What's your view of that?
That never happened.
Can you tell us why you say
For a couple
that?
of reasons. I've always lived a couple of doors away from my mum and dad. And the haemophilia centre was a day centre. Why would I be visiting him at a day centre? I was 20 odd years old, I'd be at work. I just wait till he comes home or something. That's one. And two, he's saying he spoke to me about it. I can't remember that. You know, I wasn't even a kid, I was an adult. I would remember it. And it didn't take place.
This letter suggests that there was a discussion about hepatitis C testing in 1992.
Yeah.
Were you aware in 1992 that you were being tested for hepatitis C?
No, I wasn't. No. Can I just say sort of thing? If I was aware, my thing on that is, you know, a couple of weeks after I allegedly agreed to it, I would have asked him about the results. But there's nothing. I didn't ask him. And then 2.5 years later, he's testing me again, sort of thing.
Because we can see at the bottom of the letter that as part of a study of natural clearer, you'd stored samples, one from the 2nd of June 1992, the other from the 25th of November 1994, and they were tested in October 1998. Again, were you aware of anything to do with hepatitis C
No,
over
nothing.
those dates?
Nothing.
As far as you're concerned, you didn't know about hepatitis C until November 2006.
Yep.
And did you consent to participate in this study?
No, I never.
You say in your statement there was no consent for the factor VIII treatment.
Can I
please
just go
do.
back to that letter? Sorry.
Of course.
On that letter, it says...
Just a moment, it's 015, Paul.
Yeah, what bit is it? It also says there, my first exposure, because this letter was written in 2007, 2 weeks after I finally found out I was hep C by a certain doctor, but it was written 2 weeks after. And in it, it's got first time exposure, the 5th of the 12th, 1981. Like the other letter, what you just said, Brian, she's the only one who uses them dates. Because it's the 12th of the 5th, 81, I was first. But she uses this date in another document, which I hope I'll show you soon, sort of thing. Because I don't know why she wrote this letter. Because if them samples were tested properly, you know, they wouldn't have come out negative. Plus, there was no PCR in my records. All right.
So, two things arise from the letter. One is you say you didn't consent to being part of any study.
Definitely not, yeah.
And secondly, you were not aware that you had hepatitis C until 2006.
Yeah.
And on that, you say in your statement that throughout this time you thought you were giving regular blood samples purely to do with monitoring of your von Willebrands.
Yep.
And you say, I feel that my parents and I were completely misled about what was going on, and put simply, we were deliberately lied to in order to facilitate my unwitting participation in illegal clinical research.
That's right, yeah.
Professor Tuddenham has responded to your statement. It's very detailed. I'm only going to highlight particular points that we're addressing today, but the full witness statement will, as usual, be published on the inquiry website in due course. In relation to your criticism that you were deliberately given blood products that clinicians knew were more dangerous than others, and that you there was no consent for your factor 8 treatment, he says this. For that reason, as far as I'm aware, it was not the case that any clinician at the Royal Free Hospital deliberately gave a patient blood products which they knew to be more dangerous than other products. Whilst I can only comment from what I knew at the time, from my perspective, clinicians were aware that there was a small risk of passing on a blood-borne virus with any of the blood products discussed above. He's discussed cryoprecipitate and factor 8 earlier in his statement. In those circumstances, it was necessary to balance the risks against the benefits of prescribing a particular blood product. In many situations, the decision to use BPL or factor 8 over cryoprecipitate was based on the clinical circumstances and also the clinician's knowledge that BPL or factor 8 was a more effective product. It's also worth noting that in the 1970s, 1980s, whilst the existence of the virus we identified as non-A, non-B hepatitis was known of, at the time, patients infected with this virus appeared to recover quickly from this infection. Is there anything you'd like to say in response to that?
I better not.
May I just ask, was there any suggestion in what Dr. Tuddenham had to say, or for that matter in the medical records, that given that Mark was 13 at the time, the one and only time that he was given factor concentrate, that his parents were asked to consent?
No, sir.
And no suggestion that his parents were asked to consent to his participation in a trial?
There's nothing in the medical records that I've been able to identify on either of those points, or even that there was any discussion about the transition to factor 8.
So if he was in a trial, there is no consent apparent for it?
Nothing in the medical records.
Yep.
So in January 2007, you'd been told you had hepatitis C for the first time.
Yeah.
In March 2008, you wrote a complaint to the Royal Free Hospital about your treatment, and Professor Tuddenham responded in 2 letters.
Yeah.
Can we look at document 1000-020, please, Paul? This is the second letter that was sent. And at the end of the letter, it says, necessarily my opinions are based on written records and discussions with colleagues, but I've done my best to understand what went on here before my time. You were unhappy with the response you received because you felt it didn't really answer the questions that you were asking,
Yeah.
but you were particularly upset by that comment in the second letter.
Yeah.
Can you tell us why?
Because he was my treating doctor. He was my consultant from the hospital.
That particular point in the letter leads you to say that doctors have repeatedly and deliberately fobbed you off
Yeah.
when you've asked questions about what happened.
Yeah.
Again, Professor Tuddenham has provided a response to that and says you've taken his response out of context, and he meant to refer only to the period between 1992 and 1994 when he was not working in the Royal Free. But your feeling was throughout that complaint process, which was lengthy, and we have all the documents from it, that you never really got any answers,
No answers.
to what had happened.
No.
And you had never had a straight answer about why you were given factor 8
Yeah.
or whether you were
You-
definitively part of a trial.
Yeah. Nothing. even though it says I was used in a trial, in a study. Continues, even though she says as part of a study, she still says I'm not in a study.
You're referring to the letter we looked at a
Yeah.
moment ago. Until you were diagnosed with hepatitis C, you were fit and healthy,
I was, yeah.
working full time,
Yep.
and in a happy relationship with your partner
Yep.
with 3 children. Can you describe how you felt when your hepatitis C diagnosis was confirmed?
Smashed. I was devastated. Yeah, I was just gobsmacked.
You describe in your statement that you remember feeling really angry
Yeah.
and asking how it could have happened and who was responsible.
Yep.
After that appointment, you started to do some research into hepatitis C and became very overwhelmed.
Yep.
You started treatment for the hepatitis C in February 2007 and progressively developed very severe depression. Can you tell us about the impact of that on you and your family?
Devastating. Like something I've never encountered in my life. It was just, yeah, it was horrendous. It was a nightmare.
And what happened in your family life?
Meaning Francesca and the kids. Well, the treatment got so bad, sort of thing. I turned into someone else, like. And I ended up moving out. It was easy if I just went and lived with my mum.
Because you were worried about the effect you were having
Yeah.
on your partner,
Yep.
on the children. So you separated and moved away to live with your mum.
It's only round the corner though. Well, I was away.
You've never really recovered from that.
No.
But over time, you have sought treatment for your depression
Yeah.
and tried to work through it.
Yeah.
But even seeking the treatment's been difficult.
Yeah.
Can we look at document 1000-034, please? This is a letter from a psychologist who was treating you to your GP in 2015. And if we go down to the 3rd paragraph, it says this: Mr. Stewart has a diagnosis of depression and delusional disorder, and this is in the context of fixed beliefs that he was deliberately infected with hepatitis C by doctors at the Royal Free Hospital. The evidence for this belief is unclear, and Mr. Stewart ascertains that any evidence in the form of medical records was destroyed in a cover-up. Rather than challenging this belief directly, as Mr. Stewart retains a fixed belief about his past treatment, we shifted focus to reflect on Mr. Stewart's losses and change in health as a result of contracting hepatitis C, which had evidently been very distressing and destructive for his family system. And if we go over the page, towards the later stages of the work, Mr. Stewart and I focused on the metaphor of crossroads and how now he has a choice about whether to keep fighting for the contaminated blood cause or to try and think about the things in life that are important to him and rebuild a life worth living. Can you tell us how you feel about that letter?
I haven't had counselling since that letter. because that's years of counselling, and they've ended up at that point, sort of thing. Yeah, it was devastating. I could, you know, I was telling people, they tell you open up and everything. You open up, and then you find out they don't believe you.
You say in your statement, I was and regularly continue to be extremely depressed. However, I am not and have never been delusional.
Never, yeah.
You say, I continue to mentally struggle on a daily basis and haven't been able to move beyond my feelings of anger, betrayal and utter despair that I've felt since I found out and continue to feel today.
Yep.
Do you want to add anything to that?
No.
In terms of treatment for the hepatitis C, you started treatment with interferon and ribavirin in February 2007. That was going to be for 24 weeks.
Yeah.
And then after about 6 to 8 weeks of treatment, what were you told?
I was told sort of my levels, I remember something about my levels hadn't sorted itself out, sort of thing, and I should go on 48 weeks treatment. And also the doctor said, because my brother had like relapsed a couple of months before, sort of thing, I should go for 48 weeks treatment. You know, but I was told by, can I name him?
The name is redacted at this stage.
Well, I was told by my liver specialist that I needed it. You know.
Apologies, I thought you were going to refer to someone else. You can certainly refer to Professor DeShaco.
Yeah. You know, one of the top liver specialists, and he's telling me I should have 48 weeks of treatment.
When you got to week 24,
Yeah.
what were you then told?
Then I was told you can't have the 48 weeks treatment because they're not going to fund it.
So what did you do about that?
Well, I funded it, but obviously got everyone involved, sort of thing. You know, I thought the PCT, got the MEP. I was writing to Lords and MEPs and everyone I could, sort of thing. The PCT weren't going to fund it, but...
So in the end, you funded it yourself,
I funded it,
which was something in the order of £7,000.
Yeah.
Because the advice you'd received
Yeah.
from Professor DeShaco was that your best chance was to have 48 weeks treatment.
Yeah. And if your liver doctor's telling you that, you're going to, you know... Obviously, I've got the thing of watching Angus at the same time as all this is happening, sort of thing. You know, I don't want to go down that road. I was struggling anyway, so... Yeah, I was going to do whatever the doctor said I was going to do.
So you personally funded the second 24 weeks.
Yep.
But at the same time, you complained to the Healthcare Commission.
Yep.
And after some months, you were sent a cheque for £2,800
That's right, yeah.
as a gesture of goodwill.
Yep.
What was your reaction to that?
Gobsmacked, you know, but... I was on treatment and everything. I'm not... I was being beat up from all corners, you know. Yeah,
You've said in your statement you found it insulting.
it was insulting, yeah.
You found that treatment brutal, you
Yeah.
described in your statement, including suffering 2 detached retina.
Yeah.
And it had further impact on your mental health.
Similar time at Christmas and all, within a few weeks of each other, so I was blind over Christmas.
And it had a further impact on your mental health.
Yeah.
But unfortunately, that treatment didn't work.
Yep.
And so you went on a trial of interferon, ribavirin and another drug for about 24 weeks.
Yep.
And that was also unsuccessful.
Yep.
2013, you went on to a further
Another
trial,
one. Yep.
and that was unsuccessful.
Yep.
2014, you went on a trial of sofosbuvir and ribavirin for 6 months.
Yep.
And that, at the end of the trial, your levels were undetectable.
That's right. Yep.
You've not had any further testing since then.
No,
Can you tell us why not?
because I can't trust anyone. I can't go back to them. That, you know. I can't. I don't. That's the best treatment I was going to get. You know. There was a couple of years between, say, 2009 2013, when there was, you know, these were on the horizon, these new drugs. And I had a few years of thinking, I ain't getting them. I'm on that slippery slope. So I got the treatment, and I never went back.
You said in your statement that you can't face the fear of finding out that it's returned.
Yeah.
So you'd rather just not know. You were unable to work during your first treatment. You
Yeah.
returned to work for a month, but then stopped completely because of your mental health difficulties. But in 2016, you've managed to return to part-time work.
Yeah.
How do you manage that?
Just if I feel fit enough to go work, you know, I'll give it a shot. I'll do my best, sort of thing, you know.
You found a part-time role that is more flexible and that you can do when you're able.
Yeah.
But it's quite a different role to what you were doing before.
Yeah. Yeah.
And you've obviously got some contact with Francesca,
Yeah.
and you've been trying to resolve some
Yeah.
of that. Do you want to tell us anything about how things are now,
Um.
in terms of both your own mental health difficulties and how the family?
Yeah, well, the family's all right, you know. They've grown up a bit. It's got bigger. But, yeah, there's a big gap I need to fill. But, yeah, well, you know, we're doing all right.
In your statement, you say this: my life has been devastated as a consequence of discovering that I had been given contaminated Factor VIII and everything that's flowed thereafter. I'm angry about the way in which my own life has been ruined, but even more so about the effects it has had and continues to have on my family. Despite the battles I've faced for recognition of what I've been saying for many years and the impact of being labelled delusional, I remain committed to securing justice for my father and brother. They were murdered. There's no other word or label I can think of to describe what happened to them. I live in fear of suffering the same fate and often feel it's only a matter of time before something similar happens to me.
Yep.
Do you want to add anything to that of how you currently feel?
That's how I feel, you know. I can't think of another word for it. They were given a death sentence and executed. Well, you know, they were murdered. And they can't speak now, so I have to speak up for them.
There's one final area I'd like to explore with you, and that is the issue of vCJD.
Mm-hmm.
You were notified in September 2004 that you were in the group of at-risk patients.
Yeah.
What did you do then?
Well, I had to make an appointment to go and see them. They sent you a letter. And I went along. Me and Francesca went to see him.
What were you told?
Well, we're told that we're going to be put on a register for the, for vCJD. There ain't a cure, there ain't a test. But at the same time as that, we were there because it was also put on the at-risk register.
You were told you'd not received an implicated
Yeah.
batch, but because of having received products in the time, you'd be on that list.
Yeah.
Your daughter was also said to be at risk, and the doctors wanted to tell her that.
Yeah.
What did you and Francesca decide to do about that?
We were not going to tell her. She just started her periods and that. It was like, she just started secondary school. We were not going to tell her something like that.
Could we have document 1031, please? This is a letter from the 12th of November 2004 from Dr. Lee, and it suggests that she had seen your daughter with you on the 12th of November to discuss the issues around vCJD. I've discussed with her parents, together with your daughter, the issues that were documented in the patient information sheet and answered that questions. Did that happen?
No, it didn't, no.
And if we look at 1032, we can see that this is a letter from Professor Tuddenham to you, in which he describes in the third paragraph, the second paragraph, having completed a thorough search of all our patients notified as at risk of vCJD. The third paragraph, we've notified the UK HCDO, and as a result, a similar exercise is being carried out across the whole country, since it's clear that others may have made the same mistake that we did. Close examination of the information that came to us in 2004 shows that the order was given to notify all individuals who'd received UK plasma-based products made from plasma collected between 1980 and 2001. However, it was less than clear that during the period 1999 to 2001, there were BPL products in circulation made from other UK plasma or US plasma, which only
So
differed.
it's either, I think.
Apologies, sir. There were BPL products in circulation made from either UK plasma or US plasma, which only differed in appearance by the addition of a single letter to the labelled batch number. In the last 6 years, no one else has noticed the error, which was picked up by Deborah's sharp eye when reviewing your daughter's case file. So there had been an error in notifications, and this letter is to apologise for that. But most significantly, in the last paragraph of this letter, Dr. Tuddenham says, "We remain deeply sorry for the distress and anxiety that the mistake has no doubt caused you both on her behalf. We are relieved that it was not compounded by giving her the wrong information to worry over herself, and your decision to keep it from her has been fully justified." So Dr. Tuddenham in that letter confirms what you had said to him, that you were not going to tell your daughter about the vCJD risk.
Yep.
And that makes you particularly upset, you've said, about the letter that we looked at a moment ago from Dr. Lee.
Yep.
But for you personally, Mark, the issue of vCJD is an added worry.
Yeah.
Can you tell us about what you feel?
It's just one of them things, isn't it? With all this scandal, you don't know what's, they just lie. People are just constantly lying to you. You can't believe anyone. You can't, they tell you one thing and then tell you another. It's just, it's a scary old thing, you know what I mean?
Mark, those are the questions I have for you. Is there anything else you would like to say?
No.
I'm just going to turn to Mr. Steen, who, as you know, represents you. Just give me a moment, Mark. There's two documents that Mr. Steen wants me just to highlight to you. Could we have document 1000-020, please? We've looked at both of these documents before. Mr. Steen just wants to highlight the connection. We looked at the last paragraph of the letter in which Dr. Tuddenham said, necessarily my opinions are based on written records and discussions with colleagues, but I've done my best to understand what went on here before my time. And you said in response, he was your treating doctor during the time. And Mr. Steen just asks that we look again at document 1000-019. And at the bottom of the page, 1981, we can see an entry from Dr. Tuddenham.
I'll rest my case.
Sir.
Well, unless there's anything else that you want to add, can I just thank you very much indeed for coming to give your evidence. It's never easy, and thank you.
Thank you. Thank you.
Well, we'll take a break, slightly shorter than yesterday. Come back at 2:05, please. 2:05.